Thank you so much, Walter. That was really nice. A great introduction. I I'm really happy to be back here again. I like you said, I've been to the Humanities Center Colloquium a number of times over the years, and always like coming back here and like participating in other people's talks as well. Although I haven't done as much of that as I would have liked over the past year and a half. I feel like in some ways what I'm talking about today is kind of like my version of the what did you do over the summer book report you used to do as a kid. You'd come back and say, well, how was your summer? Except I feel like the summer was the last 18 months. Although it wasn't a relaxing summer, it was actually quite an anxious and intense one, and one that has been been some of the most challenging things we've ever experienced in our country, really, in living memory. And so I guess what I'm going to focus on today is um, some of the work that I've been involved in since the pandemic started on a couple of projects that kind of intersect with each other, and the projects address very broadly some of the legal issues that arose during the pandemic, and some of the efforts by a number of people, myself included, to try to understand those, how law affected those response efforts, try to make recommendations and chart a better pathway in the middle of what we're still going through right now, and thinking about how we can hopefully better structure our legal systems going forward, or better utilize them going forward into the future. Because not only are we not out of this pandemic, this is not going to be the last major public health challenge that we're facing. We may have other pandemics. We will need to address even larger threats like climate change going forward in the future. And so hopefully we can learn some things, but hopefully we can also understand some of the things that went wrong, that went badly. Steve was making the comment a few minutes ago, that, of course we all know what went wrong, but I think there are many intersecting factors that all simultaneously went wrong, and a lot of it is on the shoulders of bad political leadership that had incentives other than protecting the health of the population. But there are a lot of other problems within our system that are much more long-standing, and so it wasn't just the Trump administration deciding that they didn't care about public health, although that was a big part of it. It was also our crumbling public health infrastructure that has been deteriorating for years. It's the kind of consistent cycle of panic and forget, where when large catastrophes happen, we suddenly remember that we need to be creating these supportive infrastructures in our society, and we need to be planning for these things, and then we fund them really well for a year or two, and then we withdraw the money as soon as it gets into the rearview mirror and people focus on other things. That cycle, which we've seen repeated over and over again in recent decades, is part of the problem as well. And then the sort of byproduct of the more extreme politicization of everything in our society, and taking things to be things that should be common sense interventions, like public health interventions, that used to have broad public acceptance, the weaponizing of those commonly held sentiments, and sort of transforming them into a political litmus test. And so I'll talk a little bit more about that too. But I guess I want to take a step back, and I had originally prepared a couple of slides, but I actually don't think I'm going to show them, because there's not that much on the slides that I can't tell you about just verbally, and I don't think they really add much. But I will put them up probably at the end to show you the links to the reports that I'm talking about. But I'm going to give you a little backstory on kind of how these projects came to be, and then I'll talk a little bit more about the substance of them. So back in March of 2020, when the pandemic was really getting underway in the United States, there was a lot of discussion among colleagues that I've done work with over the years who focus on public health law. A lot of us were very alarmed at what was happening. Many of us had been following the outbreaks of COVID-19 when they first were reported in China around the end of 2019, beginning of 2020. And the fact that China seemed to be taking very aggressive responses to these outbreaks was kind of an early sign that this was indeed one of the really serious kinds of threats that many people had been warning about for years. That there could be a major pandemic from a new virus that humans were not previously exposed to, could be an extremely harmful thing. And we've seen this happen in the past. There was a major flu pandemic in 1918, 1919, almost a little more than a century ago at this point. And we've seen other scares of those sorts in more recent years where we thought that there could be this new global threat to health. And so as it was becoming really clear that things were going to spread worldwide and that we were going to have to respond here in the United States as well. There were some early discussions just on a kind of a public health law professor listserv about what should we be doing right now. We were some of the people who had been studying these issues for years, and what could we be doing? How could we get our expertise out there in the public to try to provide good information, but also answer a lot of questions that were coming up about what legal powers were available to respond to a pandemic. And what came out of those early discussions was essentially a set of podcasts. And so we originally, a lot of the lockdown orders in the United States took effect in kind of mid-March of 2020. And we had our first of our, and we kind of cobbled together a group of people and started broadcasting essentially legal analysis on Twitter, video podcasts that we were doing as of March 31st was the first one we put up. And then we started doing them essentially almost every day for about 3 months. And this was spearheaded by a group of about 6 core people who some of whom were law professors, others were just other public health law experts. I was one of them, also Scott Burris from Temple University, Wendy Parmet from Northeastern, Nick Terry from Indiana University, and Sarah DeGia, who's the executive director of Change Lab Solutions, which is a public health policy organization that's based in California, and Donna Levin, who's the executive director of the Network for Public Health Law. And so all of these people are people who worked in the field for a long time. But what we started to do was we identified all of the issues, and they were coming up day after day after day. The legality of the restrictions that were being imposed by state and local governments on movement, on gatherings, mask requirements later on, and just dozens of other questions about how does this affect our healthcare system, what are governments at the state and federal level authorized to do, et cetera, et cetera. And so we actually produced 30 of these podcasts, and they range from about 20 minutes to an hour. 30 of them in about a 2-month period. So it was pretty much just about every other day we were doing these. And so it kind of took on a life of its own. And we were getting a lot of attention, a lot of feedback. Many of us ended up doing a lot of media related to this as well, answering reporters' questions about some of these legal issues in real time. And so what was really interesting about this, and what was unusual about this, is that most of the time scholars are not engaged in this very direct way with not only doing their analysis and putting information out there. I mean, we're used to talking to reporters from time to time when an issue comes up. We're used to writing our more detailed analyses that take a lot longer and are a lot more in depth. But here we found ourselves doing this sort of real-time, an analytical and hopefully somewhat thoughtful analysis of the issues that were popping up and putting it out there kind of just for public use. And so what this turned into was we decided that, and we had been drawing on expertise from people that we knew all around the country to come on these episodes of our Twitter briefings. And we realized that it would be good to have something that would be more of a written version of some of these analyses that we were doing in our discussions. And so we very quickly assembled a group of about 50 authors to put together a report it ended up being 36 chapters covering a wide range of different legal issues related to COVID-19. And some of the report was basically divided into 6 sections. There's a section on government powers. There's a section on kind of federalism and preemption and kind of division of powers between levels of government and branches of government. There was a section that focused on changes to the healthcare system, a section that focused on protecting vulnerable populations, a section on ensuring that efforts were being made to reduce health disparities and improve health equity in policies that were being proposed. And so it covered a really wide range of topics. And ultimately, what ended up happening was we were able to put this report together in about 3 months from conception to publication. It was published in August of 2020. And each chapter was in the vicinity of 3,000 to 4,000 words. We were really sort of strict about it with our authors, who are mostly legal scholars and are used to writing these lengthy legal analyses, law review articles that are 40 to 80 pages long. And instead, we asked them to be very concise, keep their discussions of these timely legal issues to about 3,000 to 4,000 words, but then also to have a set of recommendations at the end that policymakers could use right away. And if you, as I'm sure you all recall, the initial wave of the pandemic was extremely bad, caused a huge wave of sickness and death, especially in places like New York City that were hit hard and early in the pandemic. The Trump administration at the time, was not doing a very good job, and that's sort of underselling it a bit in responding, and a lot of the efforts of the Trump administration were undercutting efforts at the state level to try to prepare for and respond to the disease. And a lot of the recommendations that were made in that initial report that came out in August 2020 were really focused on both pushing back against some of the policies the Trump administration had implemented, which really disregarded best practices in public health, which pitted states against each other, which didn't use the power of the federal government that's available to coordinate a really effective response, with the exception of putting a lot of resources into vaccine development, which was a good thing. But I think one thing that really came out of that report, the sort of three main kind of cross-cutting recommendations that came out of or observations that came out of the report. The first is that legal authority on the books at the federal and state level is actually quite ample. There are a lot of things that federal and state governments and local governments can do to respond to a public health threat like this. Many states did use their powers quite aggressively in ways that we've never really seen before in our lifetimes. And that power is vast. It can achieve a lot. It can really restructure many things about our society, at least temporarily, when we need to make some major changes to stop the spread of a really dangerous disease. But despite that legal authority, no matter how extensive that authority is, it has to be used well. It has to be used in a way that is targeted to really achieve good public health outcomes. Many leaders, both at the federal and state levels around the country, did a poor job of implementing the authority that they had. They didn't implement their authority based on the best science and what would actually stop the spread of the disease. They didn't use their authority extensively enough to protect people from the effects of not only the disease and how it was affecting people around the country, but also how the effects of the use of public health orders to stop the spread of the disease were affecting people. And so now there were some positive indications. I mean, some of the early legislation passed by Congress, including the Families First Coronavirus Act, and some of those early pieces of legislation that provided protection against evictions, that provided protection, extended unemployment insurance, that provided just a more robust social safety net, was really important in helping people not only make ends meet when their lives were disrupted because of things like closures and restrictions, but it also allowed people to comply with those restrictions. So if you had some extra financial support coming in that would allow you to stay home while you were social distancing to stop the spread of the disease, that basic level of support is a is a really effective way to incentivize people to actually comply with those public health orders. And at least initially, I think there was some success in using that strategy. Now, whether those kinds of strengthening of the social safety net and strengthening of infrastructure that can allow people to not be completely undermined by a disruption, whether it be a pandemic, whether it be future manifestations of climate change, or whether it just be something more ordinary that upends their lives. That I think one really big conclusion that kind of runs through our report, but also runs through, I think, a lot of the analysis that's come out of the pandemic, is that societies that had stronger social safety nets fared better for the most part in their responses to the pandemic. Society, and even our society, when we bolstered it for a short time, fared better than we would have if we hadn't done so. And so that's, I think, an important lesson to keep in mind going forward. Obviously, the political headwinds are to claw all of that support back, and it's already happening. We're seeing a lot of the financial support going away. We're seeing a lot of the legal protections going away too, including things like the eviction moratorium that was in place. And so again, those policies are ones that, if we're thinking about longer term ways to strengthen the infrastructure of our society, even though those policies are expensive, they're ones that we should not forget about. And a third observation from the report is that the public health infrastructure, I mentioned this before, had kind of ebbs and flows in terms of funding, but overall the public health infrastructure in our country is completely inadequate. And this is not a new observation. People have been talking about this in the field for years, but the pandemic really revealed it very starkly. We see departments that are grossly underfunded, that are expected to provide not just pandemic related services, but all sorts of other public health services to communities. There's very little in the way of resources for those public health departments. Their staff has been greatly reduced, particularly since 2008. And so the capacity to respond was greatly impacted by that, and in ways that both obvious and maybe not so obvious. So obviously, providing services to people was greatly impacted by the shortage in workforce, but so were some direct intervention strategies that were key to responding to the pandemic. Contact tracing, for example, when cases were found, and even just collecting data so we could even track how big the outbreak was as it was growing at various stages over the past year and a half. And we're back in that situation now, where we have, despite having these amazing vaccines that were developed much more quickly than anyone, I think, would have predicted. And, every adult in the US has been eligible for these vaccines since the beginning of the summer, before the beginning of the summer. And yet we still have, in many parts of the country, very low rates of vaccination. There are lots of reasons for that. Obviously, both vaccines and other kinds of public health measures like wearing masks has become kind of a controversial political issue. It's been demonized, first by President Trump and many Republican governors, but then by many others as well. And that's really taken on it's made compliance with public health measures into kind of a partisan signifier, which is really damaging, and it's going to be really hard to recover from. I think that in addition to that, we have, and this is true of both the Trump administration and the Biden administration. There's this, and I guess it's human nature, right? We want this to be over, but there's a real tendency to declare things to be over and declare victory before we should. And we've made this mistake again and again. I mean, Donald Trump did it several times during his presidency, but President Biden has done it as well. Having the announcement on 4th of July that everyone should be go celebrate and be with the people they care about for their barbecues, and that we can, and the CDC rolling back the mask recommendations for vaccinated people, which effectively rolled it back for everybody. Those were mistakes in terms of policy. Now, obviously any policy is going to be balancing a lot of factors. It's not just what's the scientifically most supportable policy to maximize public health. You have to think about the realities people are facing. You have to think about whether people will comply or not comply and what you're going to do about it if they don't. But I think what we've seen over the past year is a real erosion of trust, much of it intentionally provoked, that makes some of these intervention strategies harder and harder to accomplish in the future. And without going too much on a tangent, there's one other kind of really key thing that we're seeing right now that's really dangerous in terms of an after effect of the pandemic. So having been through this year and a half where we've seen legal powers used in some very aggressive ways to try to stop the spread of the disease, although I think constitutionally supportable ways, we've seen, especially in the past, really in the past year, really since the composition of the Supreme Court has become more conservative, and also since we've seen some Republican legislatures in states around the country that were less, they were being less proactive about this in some respect. Well, I don't want to make a generalization about that, but basically we're seeing kind of a combination of both judicial and legislative efforts that are eroding some of the scope of public health powers that are available to respond to our ongoing threat and future threats. And so you've seen both US Supreme Court rulings and also a number of state Supreme Courts have ruled in cases where they've either overturned use of public health powers that was, under previous precedent would have been kind of clearly supportable as a use of state power to try to protect the public's health. I should say that the vast majority of cases challenging the use of public health orders to protect public health, the vast majority of those cases have been upheld. If you look at the body of cases that are out there, almost all of them have been held in favor of the government's use of powers to protect public health. There are a few notable exceptions, including a couple of Supreme Court orders that came on challenges to state restrictions that impacted religious practice. And so depending on what the court decides to do with that line of cases going forward, there could be some erosion of the strength of the state's position to use the public health authorities. There have been a couple of cases that have also, and these are mainly in state Supreme Courts, where there's been a use of non-delegation arguments to say that the legislature didn't grant the executive branch sufficient authority to enact the kinds of powers it was using for emergency response. That happened here in Michigan. It happened in Wisconsin and a few other places as well. And so there's that whole trend. And then there's a separate trend that's going on now with a lot of state legislatures explicitly rolling back public health powers. And in some cases, they're rolling back emergency powers. And in some cases, they're rolling back just public health powers in general. They're saying that, essentially local government can overrule a local public health department's orders to try to undertake public health action. There are some states that have explicitly said that the state health department can't issue emergency orders or can't issue very specific kinds of orders like mask mandates or vaccine mandates, other kinds of restrictions. We've seen some states, the state of Montana passed a law that said that essentially the use of any kind of restrictive powers at all, like even longstanding powers like quarantine authority in the health department, were no longer legitimate under state law. And so you've had a bunch of real rollbacks of these longstanding public health powers, which I think is worrying because it means that in future threats, whether it's the next variant of this disease or another disease coming down the road that we have to face, it's going to be harder for those public health officials to actually intervene because their powers will have been stripped. And now I do want to say one thing about public health powers more generally that I think is important to note, which is that obviously you don't want the powers to be unlimited. There needs to be checks on those powers. They can't just be used by who, we've seen enough examples in recent times of executive officials, whether federal or state, overusing their power or using it in a way that is designed for purposes other than to protect the health of the population. I think there are some, and there's some good recommendations in the report on these lines, talking about how you can structure state public health powers in a way that both preserves those powers to be used in emergency circumstances when they're needed, but also guarantees that they're being used with good scientific justification, that they're sort of clear review and clear standards to be observed. Now, I know I know what Steve is going to say to this, which is maybe I do anyway. That standards set by either legislation or by courts are going to be notoriously malleable anyway, and so maybe that doesn't make a difference, and courts are going to do what they want in terms
of worth a try. My thought was actually the opposite. So the Greeks had this really interesting idea that when the shit hits the fan, the ordinary processes don't work, and so they provided for a dictator, which didn't mean what we think it means, right? They distinguished between a dictator and a tyrant. And a dictator would be just put in charge for 6 months, and you just deal with it, right? And Lincoln had that idea, right? That was pretty much what Lincoln was thinking in the Civil War. And, when I said earlier that we know what went wrong, I actually wasn't thinking about Trump at all. I was thinking about federalism with this.
Okay. Yeah. Well, and I think that the response. So one thing that I think is interesting when you kind of compare the Trump administration response with the Biden administration response is that both administrations used federal authority they used it in some different ways. I mean, the Trump administration used their federal authority to funnel resources towards certain intervention strategies, to funnel a lot of money towards some of the vaccine strategies. Trump, as was his tendency in a lot of things, tended to use authority to try to play favorites a little bit more directly, that's obviously kind of problematic. You shouldn't be getting resources that you need in a pandemic based on whether the president likes you or not, or whether you say nice things about the president. And so there are a lot of things like that. And the other problem with other big problem with the Trump administration response was that there was kind of a constant undercutting of the legitimacy of the public health experts, and anytime anyone did anything that Trump thought made him look bad, he would contradict them and push back. And that really it created a lot of misinformation, it created a lot of confusion, and it created a lot of mistrust. And so, I mean, even when these vaccines were finally, I shouldn't say finally, they were incredibly rapidly developed. I think there was a lot of skepticism across the political spectrum about the vaccines initially, because some people were skeptical because they had been sort of hearing misinformation about the vaccines. Other people were skeptical because they just were developed so quickly, and they were developed with clear, obvious pressure coming from the top. And so there was concern, well, are these really, are they going to be approved just for the sake of, optics and not because they're actually safe? And I think it took a while, but I mean, I think at this point we've seen not only so much evidence from the studies and, the FDA's analysis, all the advisory committees that have reviewed the evidence, but we've also now seen these vaccines they've been used in billions of doses have been given around the world of these vaccines now. And so we know that they're safe. We know that they're effective. There's very clear data on that. And so, but the reluctance has it's pretty hard to penetrate, and there's still quite a lot of resistance to not only the vaccines but also other there's developed this really strong resistance to public health measures more generally, and I think that's something in the longer term that really needs to be pushed back on, and I think it's going to take a long time to and it's going to require regaining trust of some of those experts. I mean, I think the CDC really took a hit in its credibility over the past year, and some of that was self-inflicted, doing a poor job of communicating things, Some of it was, inflicted on them, especially with some of the efforts to try to micromanage the recommendations and not let the experts actually say what they thought. I think that during the Biden administration, we've also seen some missteps as well. I think that the Biden administration has been more willing to use its authority to kind of direct resources more broadly. The recent use of the OSHA regulation process to try to um, impose what is effectively a nationwide vaccine mandate for any large business. I think that's an aggressive use of federal power. I think it's also probably, well, at least there's a good chance that it gets upheld. It's not a guarantee, but even if it doesn't, it's really changing the norm of what the expectations are in the workplace. And I think most large workplaces are going to implement that policy probably even before those regulations even get officially released, because it is such a momentum to do that and get ahead of the curve on that. That's it's a real use of the federal bully pulpit, backed by some actual legal authority, which I'm sure will be challenged immediately. And I don't have a confident answer as to whether it will withstand that judicial scrutiny, but I think there's at least a good chance of it. But I think one of the real challenges we face now is many of the legal powers that are in place to respond to something like a pandemic are really designed for something that is quick. Most emergencies don't last a year and a half or 2 years or 3 years. Now, how we make the transition from an epidemic into an endemic situation where COVID is not going away. We're going to be living with this probably forever. I mean, we're not going to eradicate this disease, but we need to get to the point where it's just less dangerous for people because they've either been vaccinated or they have developed immunity because they've survived the disease, or because it's spreading so infrequently because so many people are protected against it that it's no longer a real risk. And that's what happened with previous strains of flu. It's what happened with measles. It's what happened with polio. There were large vaccine-resistant movements against polio as well, but ultimately that was overcome by a huge, and very complex worldwide effort to get that vaccine to as many people as possible. And when the rates got down low enough, even the people who were unvaccinated were protected. And so that's where we need to get right now. We need to continue to be creative about providing incentives for people, I think, to get the people who are not staunchly opposed to vaccines and can be persuaded, to get them to be willing to get vaccinated. And we also have to not forget all the other public health intervention strategies we have. We should be retrofitting our buildings for better ventilation. We should be continuing to take what are sensible precautions like mask wearing indoors. I know people don't love wearing masks, but honestly, it's a very simple and low cost way to greatly reduce the risk of spreading this disease. And I think that it's really unfortunate that it's become such a political controversy over mask wearing. One of the other things, and I'll just mention, I sort of forgot to mention this earlier, but we published this initial report in August of 2020. We quickly realized that everything we were working on was continuing to evolve really rapidly. So we went back to many of the same authors and we asked them if they'd be willing to do a second volume of the report. And we intentionally waited until after the election because we wanted to see who was going to be in charge, figuring that might affect some of the recommendations, which, of course it did. And we ended up releasing our second volume of the report in March of 2021. Most of the chapter, even though it covers a lot of the same territory, most of them were updated with new recommendations, new analysis, a couple of new chapters that weren't in the first edition that we added in the second edition, including one that focused on issues related to children. And so that came out in March. It was a lot of the recommendations there were designed to kind of inform the incoming Biden administration on things that they could do to really aggressively push back against this pandemic, but also thinking longer term. So how do we, what were the experiments in law and policy that worked well during the pandemic that we should keep? One really good example of that is telemedicine, right? So because people were restricted in their movements and in their ability to go to in-person medical visits, the um, both federal regulatory agencies and states as well relax some of their ordinary requirements about telemedicine visits, about reimbursements for telemedicine visits. It greatly improved access for a lot of people. And so, those were good policy changes. We shouldn't just throw them away because now people can go back in person again. Many people weren't able to go for there were a lot of impediments for and access limitations on healthcare that were in place before the pandemic, and those need to be addressed going forward. And so there are recommendations like that in the report, which talk about how can we take the experimentation and the things that were done out of necessity. The same might be said for some of the workplace policies and other things that are that have changed, and the fact that we're doing this on Zoom, which we wouldn't have been doing 2 years ago, is, I think, an example of that. Now, another piece that kind of weaves through the entirety of both reports, and I think is a really important theme and a really important issue going forward as well, is just making sure that law and policy is taking equity into account, and is making sure that we see so many disparities in health outcomes. Many of them are end up dividing along along racial lines. People of color have much more negative COVID indicators, and so in terms of higher rates of infection, higher rates of death, and also populations that might have less access to healthcare, populations that might be just more likely to work in essential jobs. So couldn't have the luxury of staying home and working from home during the pandemic, but had to keep going to work because they were working in hospitals, or they were working in other essential services, including food processing facilities, including just a lot of other really essential sectors of our society. And so the through the report, there are dozens and dozens of recommendations that talk about ensuring that equity considerations are being thought about in law and policy, that the legal orders aren't disproportionately negatively affecting populations in our society that already are facing greater health disparities and greater challenges, both health challenges and economic challenges. There's an absolutely brilliant chapter that kind of rounds out the report. It's kind of a conclusion chapter written by Pat Williams that I would absolutely encourage everyone to read, because she really captures these issues in an extremely poignant way. And I think again, going forward and thinking about, well, how do we think about our social safety net? How do we think about just the way we structure our health system and our public health system, in thinking about the fact that people are going to continue to face these large societal threats, whether it be the next pandemic, whether it be climate change, and making sure that we're designing policies that that are both trying to increase equity across the population, but are also designed to, when things get bad because of a crisis, that they anticipate that and try to be able to rapidly respond in an equitable way. One example that I'll give here is related to some other work I'm doing. Walter mentioned in the intro that I'm working with the state of Michigan to develop crisis standards of care, scarce resource allocation guidelines for the state. And so I've been working on that with some people at the state health department. And one of the things that we've been really trying to do, I mean, these are guidelines which talk about, okay, if you're in a healthcare setting or a long-term care setting, and there's a shortage of resources, how do you make decisions about prioritization? And so we talk about criteria that can be used to try to make a decision that's going to both be an effective use of those scarce resources, but also an equitable one. And I think one of the things that's really, I first worked on this project about a decade ago. And we're sort of revisiting it and revising it now. And one of the things that we were really, I think that we didn't pay enough attention to in the first draft of that report were issues of equity. And we had our principles for making allocation decisions, and we talked about looking at things like medical prognosis, who's likeliest to survive, and we talked about making sure that resources were allocated fairly. But just doing it fairly is not enough. I mean, you have to take some additional steps to make sure that if your first cut at deciding who's eligible for the resources is done in a way that just looks at who's most likely to survive, you're already putting people who are more vulnerable lower on the list of priority, and that's problematic. And that's something that should be thought about up front. And when you're targeting resources, whether you're talking about something in a hospital, who gets a ventilator when ventilators are scarce, or if you're talking about who has priority access to vaccines. And if you're saying, for example, that people 65 and over get priority access to vaccines, but there are some communities where the life expectancy is lower than 65, you're essentially cutting huge portions of the population out of that priority consideration without even thinking about it. And that's those kinds of decisions and that kind of analysis needs to be part of the discussion. Okay, I'm going to stop. I talked way too long. I want there to be some time for questions.